Good, man. My name is Dr. Ravin Chodavadia, and I'm a dentist at Enamel Dentistry. What sparked that passion was an interesting kind of thing of events, right? And so normally when I went to college, I was, on that pre-med track, wanted to go to medical school and stuff like that. And then the year I was kind of applying or about to take my MCAT, they changed the test from like a 3-hour test to a 10-hour test. My brother was already a dentist at the time, and so I was like, let me see what this is all about. So I shadowed him, I shadowed some other dentists, and I was like, this seems really cool, right? It's like you have people that are coming to your office that are just happy to be here, just getting their cleaning and seeing the dentist, having a chat and going home. And then of course you also have people that are having issues that you're able to really help them out with like immediately. Sometimes when you go to a medical doctor or kind of like a medical setting, like you're going there and it's a little bit of a waiting process. Like there's not really ever like an immediate kind of satisfaction as far as like the provider perspective, where it's like, hey, someone comes in with the problem, I can take care of that for you today. Tomorrow you wake up and you're good. I really like that aspect of it. And of course, like the social aspect of dentistry versus medicine is I feel like we get to connect with our patients a lot more. The dental procedure that I love performing the most is probably the new patient exam, because I like getting to know people, right? I like talking with them, understanding what their concerns are if they have any, and of course the best patients are the ones that don't have really any concerns. They're just here for their cleanings, and so we just get to chat the whole time. But it's really rewarding too, whenever we have patients that have a lot of stuff going on, and it's really nice kind of also connecting with those people and kind of figuring out, okay, and so it's rewarding in all aspects that new patient exam, because you get to really understand the person. I mean, as far as new dental technologies that we're bringing, I know we just got a new scanner. The level of accuracy and detail that new scanner gives us, and it also gives the patients, right, as far as being able to look at what's going on with their teeth and kind of see what we're seeing in an easier way, that helps a lot. And of course, we're using a newer implant system that we've already had so much success with just from using it. It's been really rewarding kind of to use that as well and work with the reps and kind of help them as far as what improvements that we think that could be made, and just that overall process has been really kind of fruitful and rewarding, especially for patients too. One misconception I think that a lot of patients have, everything's gonna hurt. And generally it's from previous bad experiences or just experiences they have in the past, and so anxiety kind of about that, and not wanting to feel those kinds of same things again. And so I think at least for my office, I can always kind of essentially guarantee people that I'm not gonna be working on you if you're in pain, right? We have a gentle hand and we try to make sure that you're as comfortable as possible. We're gonna make sure that you're not like going through this cleaning, like feeling pain the whole time. It's like, I always let patients know if you're feeling uncomfortable, you need us to stop, you need to take a break, you need some sort of numbing jelly or nitrous or sedation or whatever. I think that common misconception is like, oh, if I go in, I know it's gonna hurt. Not always the case. We do like everything we can to make sure that doesn't happen. I wanna say we have pretty good success. Our patient-focused approach, like compared to like some of the other offices that I used to work at, like kind of when I was right out of school, in our eyes, it's about the person that walks through the door, right? Everyone's different. So everyone has different kind of levels of what they need or what they're looking for or what kind of comfort levels they have. And so what's different here is like, that's how we treat you, right? You're not just another patient on the schedule that's walking in. You're an actual person that has different needs and wants and concerns. And so we treat you like that. A small transformation that kind of left a lasting impression on me. One of my first patients actually at this office, his thing was, he was terrified of the dentist. He's never had a good experience. And so we came in and we talked it out, and he's a big Longhorn fan, and so we connected on that. He just became immediately comfortable, and we fixed up his front teeth. He was able to smile again. I love seeing him all the time now. Favorite way to spend my free time in Dallas is probably chilling at my house and watching TV or playing video games, or we like to make food, try food, so stuff like that too. But yeah, I pretty much do that. Pretty boring person. I'd say. My favorite Disney movie is Star Wars, because Star Wars is now Disney, so any of the Star Wars movies. Yeah. So dentistry wasn't my passion, and if I was to choose like a dream career to chase, I've always said I wanted to be an astronaut. Definitely not smart enough, so that was never gonna happen. But I've always just been, kind of amazed with like stars, space, and wanting to go to the moon or go to Mars, so I don't know. I'm gonna have to write to Elon and tell him like I'm down if he's looking for somebody. But yeah, free space in that spaceship to take me to Mars.